everyone, for coming. And thank you, David, for taking the time.
Thank you.
Appreciate it. Should we just jump right in?
Yeah, let's do it. Let's go.
All right. So you were at Facebook for 5 years and left to go back into healthcare. And I think tell the audience a little bit about your background in healthcare and why this is of interest to you in the first place.
Yeah. Well, let me start by saying thank you, and thanks to everyone at Rock Health and everyone in the audience. It's my pleasure to be here, and look forward to the conversation. I left Facebook to start Lyra Health because I thought that behavioral health specifically was one of the most important problems and opportunities in all of healthcare. So let me start with a definition for those of you who haven't experienced the space. Behavioral health includes all the mental health conditions like anxiety, depression, as well as substance abuse. So the most prevalent behavioral health issues are anxiety, depression, and alcohol abuse. And this year in the United States, 50 million people will suffer from a diagnosable behavioral health condition. So about 20% of the adult population. Everyone in this room, if you think about your network of people that you are friends with, your family, et cetera, you will know people who this year will suffer from a condition that has a real diagnosis and potential treatment associated with it. So the prevalence is really stunning and notable. Just as important, we really don't do a good job getting effective care to those people. The system really doesn't work very well today. So for those 50 million people, 1 out of every 7 will receive effective treatment. The other 6 will be some combination of undiagnosed, diagnosed but not treated, or treated but with something that's not effective, not evidence-based for what they're suffering from. So for me, that's really the crystallization of the problem statement that motivated us to start Lyra Health. Was we have a situation where the disorders are very prevalent, we do a bad job getting effective care, and I guess the last piece of the puzzle that I didn't mention is that maybe that would be more acceptable if there weren't good treatments. If the treatments were bad and we didn't get them to people, that would be one thing. But in this area of medicine, we actually have effective treatments for many of these conditions. So, for example, in depression and anxiety, the best care available can deliver response rates as high as 70%. So for 70% of the people who are suffering, we can alleviate their symptoms and make them feel significantly better. And yet, despite the fact that we can make that big a difference in people's lives, we haven't built a means to make it easy for people to get that kind of effective care.
So you guys launched Lyra in June, is that right? Earlier this year. There have been a couple of articles about it, but maybe tell us how it works. What do you guys hope to accomplish?
Yeah. So there's 2 core solutions that we have been focused on building. The first is a matching solution. So right now, if you have a behavioral health condition, trying to figure out what care you need and where to find it is really difficult. Trying to navigate the system is a very confusing experience. So the matching solution that we're trying to build makes it easy for people to interact with our technology so that we can capture information about what their clinical needs are, what their treatment preferences are, and can then apply our knowledge of what the right clinical guidelines are, so what the right evidence-based care is for the condition that they're suffering from, and then bring to bear our knowledge of the providers in the geography where you live as a patient, and who those providers are, what their specialties are, what they're skilled at, so that we can in real time and quickly and easily give you a match with the treatment and the provider that is most likely to help you. So that's the first solution we're working on. The second is outcomes tracking. So even with the best technology at a patient's disposal, it's hard to know for sure that the first thing you try is going to work. And we certainly aren't going to know that if we don't measure it, if we don't stay in contact with the patient and see whether or not they're getting better. Sometimes if you have one of these conditions, you have to try a second thing or a third thing. Maybe the first medication doesn't work, you need a different dose or a different medicine. Maybe the first therapist you don't connect with very well, you need to see somebody else. By staying in touch touch with the patient and understanding whether or not their symptoms are improving, we can help to adjust their care and their treatment plan to try something else if they're not getting better. So the core of what we're building is really a matching solution and an outcomes tracking solution to help manage care. Our approach to bringing those to patients is really to work primarily with employers so that we can make our technology available to the employees that they provide care to and their dependents.
So I have a lot of questions about that, but let's just dig into the diagnostic side. So how do you diagnose these problems? How do you get this, this option in front of patients?
Yeah, so for many of the major behavioral health conditions, there are validated and commonly used screening tools that you can quickly and relatively easily take that will give a sense for whether or not you're suffering from depression, anxiety, substance or alcohol abuse. So what we've done simply is to digitize those tools, make it easy to get them in the hands of patients. So quite quickly, we can get a sense for what someone's clinical condition is. That's a very important part of the process and not as challenging as it might seem.
But how do you get that quiz in front of somebody who needs it? So you think about a condition like depression, a lot of people who suffer depression don't know it, or they're in denial and they're not thinking that they have depression. So how do you get that quiz? How do you get this option in front of people?
Yeah, there are a couple pieces to that are important. One is that there are a lot of things in healthcare where we do universal screening, where we test everybody at every medical interaction for what your blood pressure is and if there's a blood draw for what your cholesterol is, et cetera. More and more screening for behavioral health conditions, or for the common ones, because it's easy to do, can be a part of your your sort of basic interaction with the healthcare system. And that is, as I said, becoming more and more prevalent in certain parts of the country and very helpful and important. A second thing that we're working on is predictive modeling, so that we can understand, based on your medical history, people who are at higher risk of behavioral health conditions and might be in need of care. So for example, after having a baby or after having a heart attack is a time period where the probability of suffering from something like depression is quite high, after diagnosis of diabetes. So we have these triggers that we can use to be enriching a population that we then try to reach out to and encourage to take the screeners that we've built. In addition, what we're trying to do is to really create an experience of going through the screener that doesn't feel heavy and threatening. Because these conditions are so prevalent, because it's so easy to get a diagnosis quickly, because treatments are available, it should be easier for people to get through the process of providing the kind of information that helps us to connect them with the right care. And that's a core challenge that we have to work on.
How do you actually approach people who might be at risk for some of these issues, anxiety, depression, and I think especially substance abuse seems to be, how do you approach somebody who seems to be at risk?
Yeah.
That seems like potentially awkward, potentially,
And again, what we're trying to do is, on the one hand, provide opportunities to inform broad populations of people about what service we offer, so that we aren't giving someone the specific outline of why they need to engage because of what we know about their medical background, but rather this is a service that we're making available to all employees. It's simple to use. Here's the reasons why this will be an easy experience for you and in your best interests. For other experiences, like after having a baby is a really good example. That's a time period where the healthcare system is going to be communicating with you a lot, and where we think we can introduce the need for screening in a way that should be received, I think, relatively easily, because there's a common understanding of postpartum depression as a situation that is important and is quite prevalent.
So instead of saying, hey, you seem to be depressed based on we've been watching you and this seems to be a problem you have, just sending them a nudge saying, hey, this is something that is available to you. Is that enough?
It's never completely enough, which is where universal screening is going to be more effective at trying to capture everybody. But there's ways of wording the interaction that are less threatening and concerning to people that can help us to engage some percentage of the population.
Can you talk a little bit about your partnership with Castlight? How does it work? What are you hoping to accomplish? Why were they the right financial partner for you?
Sure. So Given our strategy of trying to bring our service to patients through employers, one of the things that we wanted to do was find the most efficient way for us to sort of get some scale, get off the ground, get the product in people's hands. And Castlight, as many of you know, is a company that sells to the enterprise, has relationships with benefits leaders at many of the big companies in this country. The ability to leverage their relationships and their sales force so that we could stay focused on building the product and on really developing sort of the early use cases that we needed and not on building the commercial infrastructure in our early days felt like a really useful way for us to try and get some scale. With any of these kind of products, as you know, the more we get them in patients' hands, the more we learn what works and what doesn't, the better off we're going to be to add value. So being able to get to scale quickly was one of the things that we were most excited about in working with Castlight.
Was this a make or break partnership for you? Could you be where you are today without Castlight as a partner to help you get there?
We're really excited to be working with Castlight. There are other channels through which you can imagine distributing to large enterprises. So we will probably find ourselves working with many different partners over time.
I'd love for you to talk a little bit about the matcher, sort of the technology that you have that takes somebody's diagnosis and matches them with a potential provider in the area. What kind of data do you pull from? How do you figure that out?
Yeah, so I think that if you today tried to find a behavioral health specialist, the experience you would likely have would be very poorly personalized and targeted. So often you will be directed to a website that might list hundreds of providers that are pretty indistinguishable from one another in the eyes of the consumer or the patient trying to figure out what direction to take their care. What we're trying to do is to provide a very different experience, where the first thing we're going to do is try and understand what a patient's needs are. So again, using some of the tools that are available to understand what a patient is suffering from, why they might benefit from treatment. Just as important, preference matters in therapy for behavioral health conditions, particularly because in many cases, there are options that all work. So for example, some people really are interested in medication, and some people just don't want to go anywhere near it. Some people are very keen to talk to a therapist. Others don't have the time or the confidence or the belief to do that. So one of the things that we're trying to do is, rather than providing someone with a whole list of alternatives and then they have to figure out which one matches what their treatment preferences are, is we're trying to pull that information from a patient so we understand they're more likely to adhere to a treatment plan if it matches them to something that meets their preferences.
How big of a role, and I guess how much weight do you put on a patient's preferences?
If there's choice, if there's multiple things that work, we want to direct someone towards something that they are inclined to want to try and stick with. So, for example, I talked about therapy before. There are computerized versions of cognitive behavioral therapy, which is sort of a core psychotherapy for depression and anxiety, that work quite well. There's great sources of evidence to support that you can get most, if not all, of the benefits through computerized therapy. So if we can ask people the right questions in advance, and if people don't want to go to a therapist's office or don't even want to do it over their phone, which is, again, a choice, people might want to do interacting with a human, but over the phone, that's someone who might be interested in a computerized version of the same kind of therapy. So what we don't want to do is direct someone to a care program that there's no evidence to support it will help them, just because it's what they think they might want. But where there's multiple treatment options, all of which have evidence to back them up, embracing what someone's preferences are, I think, is a good way to increase the probability that they actually fulfill the treatment plan.
It's interesting. I mean, they talk about this problem in economics, right? The stated preferences versus revealed preferences. Often people say they want things and act a very different way. Did you think about that at all in developing the matcher? Did you think about?
Yeah, we very much have. And so an example of something like that would be for people who are interested in a therapist, their willingness to tell us the biases they have about what the profile of that therapist might be less robust than what they actually really care about in terms of that profile. So my understanding, for example, with dating sites is that there's certain information people are willing to provide about here's what I'm I'm looking for. There's other information they don't provide as freely, but is completely underlying, and very predictable in terms of who they're going to want to connect with. The same kinds of realities apply in looking for and finding the right therapist. And so we are trying to both embrace what people are willing to tell us, but also what is likely inferable based on sort of population level knowledge of how to create that how to match someone with a therapist with whom they are more likely to have that therapeutic alliance, which is so critical to getting better.
Is there anything you can tell us about what makes a particular match good? What's an ideal match versus what's a less than ideal match? Is there any data?
Again, the only thing I would add to making sure we understand what a patient's needs and preferences are is you also really need to understand what the provider's capabilities are and what their practice patterns are. So this is information that's very important to making the match work right. As you can imagine, in a field that has so many different conditions and is quite complex, not every provider is skilled and experienced in taking care of every kind of patient. And experience matters and skill matters, and being able to connect a therapist who has the right experience and the right skills for the situation and the patient you're trying to help is critically important.
Many providers don't take insurance. So how do you figure out or solve for that kind of supply issue?
Yeah, so this is important too. So what happens a lot in behavioral health, I think about 55% of, I think this is psychiatrists, will accept insurance. For many others, they won't accept insurance, but the individual can then bill the insurance and get reimbursed at some rate for the care that was provided for an out-of-network solution if someone's out of network. So for a lot of people, there is sort of an economic backing to this. One of the other pieces of the experience of going through our matcher is to understand what your insurance is, what your willingness is to pay out of pocket, et cetera, so we can then make sure we incorporate that into providing you with a match that's going to meet your economic needs as well as your clinical needs. We don't want to tell you that the best match for you is someone you can't afford and aren't going to be interested in going to.
Can you talk a little bit about your background? If you could take a step back for a second. You worked at Genentech for 15 years, Facebook for 5. How did those experiences shape the goals of Lyra? How did you kind of come up with this idea? How did your background help you kind of figure out a mission statement?
So there's a lot to that question, and I'm happy to take all of it, but the last part I'll start with, which is how I got interested in behavioral health, which doesn't take me to the companies so much. My interest in behavioral health specifically really stemmed from a personal experience with the system. So some number of years ago, I needed to find care for a family member, and it was a really eye-opening experience. Some of you in the audience may have had a similar one. It was very difficult to figure out what I was looking for. It was very difficult to understand where to find it, and when you did find care, to understand whether it was the right care or whether or not you were heading in the wrong direction. And it was frustrating, it was confusing, and honestly, it was very lonely. And this continued for a couple of years, sort of wandering in and out of the system, occasionally getting connected with care that didn't work, and then sort of starting over. And it reached the point for us where we had really given up on the idea that the behavioral health system was going to help us. We felt like it was there, but it couldn't meet our needs. To our great fortune, a friend of ours recommended a provider, a psychologist, near where we lived. And at this point, we were sort of, ready to give up, but we said, okay, we'll try one more time. And we ended up having a truly life-changing positive experience from this last connection. The positive outcome is probably the most important thing that's happened in my life, and something that I'm really grateful for every day. I do not take for granted. And so going through that experience, then learning more about the system, learning how common that is, how many people can tell a story that's so similar to that, or even worse, because they never found good care, and understanding that we can use technology to make the system work better was what motivated me to do this.
We have a lot of questions that have already started to come in. A lot of them are good ones. So I'm just going to start with one in particular. How how do you guys, a significant percentage of mental health patients don't have smartphones. Think of Medicaid beneficiaries. How do you reach them at some point in the future? How do you think about that population now?
Yeah, this is something we do think about a lot. It's a very good question. One thing we're doing for starters is we are starting with an enterprise population that will be easier in terms of technology access. But for what we're building, we 100% aspire and need to get it in the hands of more and more people. So there are a couple of states that are more aggressive in terms of trying to improve the quality of behavioral health care that they can offer to the Medicaid population. We're trying to get to know what they're doing, how they reach those patients. One of the things that we do know is for those patients who are going to the primary care physician, that's a point of interaction we can try and be a part of and leverage. Much of the behavioral health in this country takes place through primary care physicians. More than half, about 60% of behavioral health care is done by primary care physicians. So if we can reach out to the providers, that might be an effective way for us to bring our service to support them and to help the patients who aren't going to be able to access our services using technology.
Is this technology out in the wild yet? I mean, what kind of pilot programs are you working on now?
Yeah, so we're very close. We started the company at the beginning of the year, and priorities for this year, as you can imagine, were really building the product and then developing the initial pilot relationships so that we can get it out there. And our goal is really for 2016 to be the year where through our pilot partners, we get the technology into patients' hands, start having the thrill and the experience of helping patients, but also developing the knowledge of how the patient works, how the product works, where it breaks down, et cetera, how we need to iterate and to fix it. So we're very excited for next year.
How have you kind of built your resources to handle each of these different conditions? Did you plan for depression differently from anxiety and differently from substance abuse?
Yeah, so the resourcing in the company has been a lot of fun. I'm really proud of the team that we've built, and it's a great group of people who are really passionate about this area of healthcare, often because of personal experience. What we need to do to be successful is to have a really awesome technical team, trying to draw on the best software engineers and data scientists who are really interested in this particular set of problems. But we also need to have a really excellent clinical team that understands what the right care pathways are, so we build that into the experience that patients have. Right now, we've decided in the first iteration of our product, behavioral health conditions, there are a lot of them. We can't build them all at once at the starting point. So we're starting with depression, anxiety, and substance and alcohol abuse because they're the most prevalent, and really focusing on what the right treatment pathways, the evidence-based treatment pathways are for those conditions. There's no one person that we can hire who knows every behavioral health condition, but the good news is it's easy to tap into experts who really specialize in the various other items that we want to touch. The people who dedicate their lives to helping patients with behavioral health conditions are generally quite eager to support new approaches and new technologies that will help more people get connected with effective care. So our sort of list or network of advisors is very important to making sure that we can provide the right treatment paths for all the conditions that we want to help over time.
How kind of essential were these experts in figuring out, in reviewing and choosing those treatment options that you made available?
Yeah, what we've tried to do is make sure that as we think about the pathways that we will put patients through, that they're based on the best evidence that's available, and that's what we've done is to run by our reading of the literature with experts who spend their time treating these kinds of patients to validate that we're doing the right things for them.
How about reviews, Yelp reviews or, ZocDoc reviews of specific providers? Is that data that you pull from now or could pull from the future?
Yeah, the patient feedback about the quality of their physicians is one source that we are drawing from and that is relevant. It's not always reliable in terms of the quality of care. Sometimes it speaks to other things. The sort of joke in healthcare that you probably know is it speaks to whether or not you can get parking, near the provider. That influences the patient ratings more than anything else. So it has other elements in it that may not speak to whether or not you actually got the right care and got better, but it's certainly of utility and something that we want to include in the various data sources that we're drawing on to drive our algorithms.
Which kind of leads you to the next part of your business plan, the next solution, which is tracking. And how do you follow up with patients and actually get them to respond to you?
Yeah, once we have a relationship with the patient, one of the things that we want to do is make sure they get comfortable using our technology and that it's easy for them to provide feedback to. So I talked earlier about the fact that in making screening or diagnosis evaluations, there are simple tools with questions that people can answer. We use those same tools to follow up and to assess whether or not people are getting better. So it's an experience that they've now had and are having again. They know it's quick and simple, and we can explain to them why taking this test again is in their best interest and is going to help them in terms of getting great care. We also try and back that up with the ability for every patient to connect with a human if they don't want to interact with the technology directly. So in behavioral health, in various experimentation that's occurred in clinical studies around the country, providing a behavioral health patient with a care manager who helps them to navigate the system, answer their questions, make them feel like they can be heard when they're confused, very consistently leads to better clinical outcomes. So we want the patients who we're helping to have that option as well, and to make it easy using our technology, that if someone just gets confused or frustrated or just wants to talk to someone, that they can do so right away.
How many of those care managers do you expect to have eventually?
Yeah, it's what we need to do is to find a way to use the technology as much as we can and rely on the care managers, I should say, kind of as little as we have to. So the good news is that a care manager can take care of a large panel of patients. They don't need to talk to the patient every day. They need to be there to sort of backstop when the patient needs help and is confused by the technology. And I think if we make the technology work well and really leverage the quality of being able to satisfy as many needs as possible using technology, we will need to have a small team of care managers to care for a certain patient population.
I'm going to go to another audience question, which is from Richard Schwartz. Hello, I don't know where you are, but how big of a barrier is behavioral health stigma? How do we destroy it?
Yeah, it's a really important one. So people are scared to admit that they have a behavioral health condition or don't want to even admit it to themselves in many circumstances. So the good news is I think we're making progress. I think as time passes, if you remember decades ago, a similar stigma existed about cancer. It doesn't exist today. So people didn't talk about if they had cancer themselves or in their family. So we need to make sure that as a society, one of the things we're doing is educating people about how prevalent these conditions are and our ability to help and effectively treat people so that there is a motivation to work through the barrier to admitting that you might need help. The other thing that we believe to be true is the more we can make this technology something that someone can interact with in a manner they're comfortable with, that might be easier to get them through. So making sure, for example, that they can take the screener at home and they don't have to, take it in work in front of anybody if they're embarrassed to do so, or take it in work in a conference room if they don't want to do it at home. But technology, again, I think is an enabler of having people find an environment where it can be safer and easier for them to try and take the first step towards understanding a condition that might be affecting them.
How did your experience at Facebook help you think about the role of technology in healthcare?
Yeah, I mean, I'm completely sort of moved and informed by the experiences that I had at Genentech and Facebook and what I learned from those companies. And I draw on that every day, as you can imagine. They're great companies. They do really interesting and hard things. Facebook in particular is where I really learned the power of technology and how software and data can be used to make experiences so much better and so much easier. I'll give you an example of some of the things that I really took from Facebook. One of the things that's so magical about Facebook is how the experience is completely personalized. So if everyone in the audience right now opened up their Facebook account, no two people would be looking at the same thing. And that is, I don't want to say completely absent, but generally absent from your experience in healthcare, where you're going to get a static interaction with the same information that everybody else who searched for the same thing would get. So one of the core pieces of what we're trying to build is a personalized experience that provides you with the right match and the right care for your unique needs, and not generally for anybody who might be suffering from a behavioral health condition. Another thing that I think Facebook does so beautifully is take advantage advantage of all the data that's available to it to try and make the service better. So every day, all of the interactions that you have with Facebook, what you like, what you comment on, what you choose to read, is rich information that Facebook can use to know what content to put in front of you tomorrow that you're likely to find more engaging. So when you go to check your Facebook account, if you're an active user and you interact with the service a lot, you probably are faced with content that you find interesting and not random content. Again, in healthcare in general and behavioral health specifically, there isn't a lot of effort into actually tracking whether or not people are getting better and to using that information to make the whole system work better. So in the personal experience I shared with you earlier, at no point in our journey were we ever asked for any feedback, or did we ever receive a clinical reevaluation? So no data was even captured that could theoretically be used to help the next family have a different and a simpler and a better experience. So one of the things that I think is really important in healthcare is a commitment to actually capturing that kind of information and then using it to make the system work better over time.
The Facebook example is a great one because these personalized news feeds can be delightful, and some people can also find them very creepy. So how do you toe that line between being, violating somebody's privacy and then being useful?
Yeah, I think that the experience that we're trying to build, for starters, is a relatively simple one. It is personalized in the sense that the care we're recommending for you should be tailored to what your needs are, but we're not trying to do something that's going to, tap into some source of information that you would be really uncomfortable with us knowing and then, throwing that back in front of you. I think you do have to be careful with how that works. The good news is that, I think things like privacy and data security have to be critical to a company like ours, because we have to earn our patients' confidence that we're going to protect their interests and make sure that nothing that they don't expect to happen is going to happen to them. So you have to build that into your thinking about your product from day one. And a lot of the infrastructure, the ways to do that already exist. If you think about the rules that HIPAA brings to the table, making sure that right now we have an experience that you have if you get healthcare through your employer where you can go to the doctor, you can get treated for something that might be very personal. Your employer pays for it, but they don't know that you got that treatment because the right sort of boundaries exist that keep the information that you would want private between you and your provider. And we have to make sure that we create experiences that are similarly sort of transparent, easy to understand, and make a patient feel comfortable that the information that they might be sharing is being used to ensure they get good care and not for other purposes.
So how do you accomplish that? How do you build trust? Is it just a matter of disclosures that are clearly written right up front, or making sure that every data transfer from the patient to you is opt-in, not opt-out? How do you think about that?
Yeah, the first thing is you have to make sure that what you build actually accomplishes what you're going to tell someone. So the first thing is making sure you build the product and the infrastructure that is going to accomplish the protection you want. Then making sure you make simple and transparent disclosures so that someone can understand what information you're collecting and for what purposes. But then you earn the trust based on their experience. I mean, just like something like Facebook, you take a risk using it in the sense that maybe the first time you don't understand it, you don't know what's going to happen, but you have a good experience and bad things don't happen. And you learn over time to trust that, wait a sec, this is good for me. Like, I like this experience, this adds something to my life. We have to help people. And we have to do so in a way that over time increases their confidence that this is the right thing for them to do because it helps them to get better and reduce their suffering.
Does Facebook have a role in healthcare, in this world that you now occupy? Could they ever do something in this area?
Well, I think, as you know, what Facebook does today is it builds certain products and technology itself, and then it has a platform that enables other third parties to build services that tap into the network if people choose to use those services and integrate them with Facebook. Facebook today, to the best of my knowledge, actually a year ago today I left, so who knows what they've done in the last year, but as of a year ago was not building any behavioral health services that I'm aware of. But the others had built interesting things to help patients, like communities. So there are many communities on Facebook that connect people who have similar medical or behavioral conditions and makes them feel more a part of a community, more connected in terms of what they're trying to accomplish with their treatment, which is awesome. And those kinds of things that Facebook provides are very useful. I'm confident that there is information in Facebook that would be helpful to someone trying to make a diagnosis. So for example, knowing someone's social activity is probably a pretty useful leading indicator of someone whose depression might be worsening or getting better. We don't have any ideas for how in the short term we're going to tap into that data, so that's not what we're building. Over time, we'll see what kind of integrations become reasonable and acceptable. But that to me is certainly something that I can imagine many years from now being an incremental set of information that helps services like ours to do an even better job providing patient care. But I don't expect in the short term that Facebook and what we're doing is going to be integrated in any fashion.
Mark Zuckerberg talks a lot about education, but also a little bit about healthcare. And if his wife Priscilla is a doctor, and this is something that they're starting to talk about more and more publicly. Did Mark provide any advice for you? Did you talk to him about this before you started?
Yeah, Mark's really interested in healthcare, and I mean, at a high level, Mark is a fantastic leader, and I've learned so much from him that I can't sort of, list it all in the time we have. But I could, there's one piece of advice he gave me that is front of mind frequently enough that I will share it. So when Mark was talking to me about what I was planning to do, and was trying to give me a flavor for what he imagined some of the key differences being between working at a bigger company like Facebook and a startup like I was planning to do. He said that one of the experiences that he didn't imagine that I'd ever had in my career, but that I needed to be prepared for, is when you start something from scratch, there will be moments, and there may be many of them, where you feel like you've hit a wall that you can't get around. Just the wall is too high, that you have no means of getting over it that you can figure out. The wall is too wide, you don't know how to get around it. There's no logical reason for you to keep going. And he said in those moments, you just have to keep going. You just have to keep working at it and just trying to find a way to get through whatever the problem is. And despite what logic might tell you in the instance, if you're working on the right problems and you're passionate enough and thoughtful enough about it, at some point you'll find yourself on the other side of the wall. And I've certainly experienced in my short period of time as a startup entrepreneur, it's really hard. And there's more problems that, every month you learn about new problems you hadn't thought of yet. You have to have that resiliency and that commitment. And what I feel great about in terms of what we're trying to build is it's easy to have that when you're really passionate about what you're trying to do. If you really care deeply about the solution that you're working on existing in the world and being able to help people who you think can be helped, that you have the opportunity to help, it's worth continuing to fight, even when you feel, frustrated or down, and you definitely are going to have days like that.
I think you, in one of our previous conversations, called it the willingness to be unrealistic. Is that right? Yeah.
Yeah, I don't remember if those were his exact words, but there's definitely an element of this where you have to sometimes not let reality seep into your worldview, and so that you can keep battling and trying to get to the next milestone and make the progress that you need to make.
So if you think about the healthcare landscape now, it's one where there are a lot of incumbents, but there's also a lot of change. There are a lot of startups coming up, all trying to tackle some piece of the healthcare system. How do you go up against incumbents, sort of entrenched businesses that have been in this industry for decades?
Yeah, well, let me start by saying I think this is a unique and awesome moment to be trying to bring change to healthcare, and I imagine that just about everybody in the audience probably shares my optimism. I hope you do. And there's a couple reasons for that are worth mentioning. So the first is just that we have technologies that are so powerful and are demonstrating their ability to improve and disrupt industries, every day. And so these technologies they either didn't exist or weren't as easy and as cheap as they are today 10 years ago. So we have tools to apply to the two problems in healthcare that are just really exciting and really powerful. But a second reason that I think is just as important is I've never experienced the healthcare system being as open to change as it is right now. So, I've been in the workforce for 25 years. So for 25 years, we've been talking about the rise of healthcare costs. And for most of that time, it's been I don't know, the metaphor I use sometimes is it's like the boiling frog. If you stick a frog into boiling water, it'll jump out immediately because it's like, I don't want to be there. If you stick a frog into cold water, a pot of cold water, and you slowly turn the heat up, the frog will just stay in the water and die because it's like the change is so incremental. In healthcare, the costs getting higher, the system not working well, it's just been such a slow and incremental series of problems that while everybody knows it's happening, the motivation to change it. When I remember in the early 90s when we were talking about healthcare reform, everybody I interacted with agreed that we should change healthcare, and everybody was adamant that someone else should act differently. What they were doing was fine. Wherever you sat in the ecosystem, someone else had to change. And I just don't feel that today. And I think that the Affordable Care Act really gets the lion's share of the credit for just making people throughout the system feel that change is coming, and if they stay still, they might be left behind. So the receptivity that we're getting for the kind of service that we're building from incumbents who really don't want to be stuck in an old way of doing things as the system evolves, I just don't think it would have been as positive some years ago as it is now, and that makes me really excited and looking forward to watching the system evolve. The third thing that is more behavioral health specific that I should also mention is I think there is more appreciation today than there ever has been before of the importance of behavioral health. So one thing I haven't talked about a lot is that sort of the last piece of the puzzle in getting me excited to start this company was understanding that there was an economic incentive to fixing behavioral health. So it turns out that not only do we spend a lot of money on poor behavioral health care in this country, it's very inefficient, but on top of that, behavioral health problems underlie a lot of chronic expensive medical conditions. So if you have diabetes, you are twice as likely as the general population to suffer from depression. And if you're a diabetic with depression, you are 3 to 5 times more expensive than a diabetic who doesn't suffer from depression, which makes perfect sense if you think about it, because if you're depressed, you're less likely to be able to rise to the behavioral changes and medication adherence and all the challenges that you need to manage to prevent the progression of your diabetes. And the point here being that as you think about the things we can do better to try and reduce the growth in overall healthcare spend, it turns out that better management of conditions like depression and anxiety, which are not that expensive to manage, is one of the most important investments we can make to try and control the overall growth of physical medical spend. So the receptivity across the board to investing in behavioral health is really encouraging. And you see that, for example, in the parity laws that many of you probably know what those are, but I'll explain just very quickly, that historically, many healthcare benefits and health plans didn't offer any behavioral health. It was a physical health benefit, and you had to pay out of pocket if you wanted mental health support. Now legislation has passed that forces plans that are involved in things like public exchanges to offer mental health benefits and to offer it at parity at the same level of quality as the physical health benefits. This is still in the early days. People complain a lot about how parity actually works, but just the fact that that legislation passed shows that there's an understanding that this is an important area where we need to do better, and that really is another reason why I think today is a uniquely great moment to be trying to develop the kinds of company that we're building.
So my last question will be an audience question.
Okay.
Which is, Facebook and Google have become somewhat of a model for the kind of rich benefits that a lot of Americans like and want and need. But what about startups? What can Silicon Valley do about stress and mental health issues in startups? And is the pressure to become a unicorn ruining lives?
Well, so I don't have a deep expertise in this particular question. I haven't thought much about startups and mental health, other than to say that there is no doubt, because I'm doing it, it's really stressful, right? So I can understand sort of where the question comes from. It's a really difficult thing to do, to try and build a company from a standing start. Like when I went to work at Facebook, I didn't appreciate it at the time, but I sure do now. It had all this momentum, and every day you could come in and you try and add value and make it work better, but you could build on what so many people had created and started before you. When you're starting from a standing start, it's just really hard, and there's a lot of difficulty and stress involved in doing it. So I think the kind of service that we're building and making it a part of what a package of health benefits looks like at startups as well as larger companies is the best idea I can think of for how we can make it easy for people who are feeling stressed and are suffering from anxiety to be able to easily connect with the care that can help them. And the good news, as I said earlier, that I think makes this a solvable problem, even if a very real one, is that we do have good therapies that will help people who are suffering from that. And as I said earlier, there's medication, there's psychotherapy, there's computerized therapy. These things have all been proven to work for many people who are suffering from stress and anxiety. And what we need to do is make it easier for people to connect to those therapies, to understand that they're out there and that they can benefit from them.
Would you expect eventually Lyra to be available to startups? I mean, right now you're working with enterprises and...
Yeah, I mean, so it's a question actually that we've thought a little bit about, because one of the nice things about startups is they tend to be friendly to other startups and willing to try new things. And so the challenge for us is that, as many of you can probably relate to, when you're trying to improve the first iterations of your product, you want lots of usage. You want a lot of users, because then you can iterate more quickly. And working with one large company, you're going to get more, is easier than trying to work with a lot of startups. But yes, it would absolutely be something that over time we would imagine working. The mission of the company, the aspiration for Lyra Health, is to make our service available to everybody. It's just a question of figuring out in what order we do that and what the best way is to get the service in the hands of people who can benefit from it.
Well, thank you, David. There's still a lot of questions kind of coming through. There's a lot of interest in the company. I'm sure a lot of these people will line up to speak to you after. But in the last 8 seconds, is there anything I didn't ask and should have?
I guess I was just thinking about the stress. I couldn't get past that. You asked me about stress. You made me stressed. So the one thing I would say that I hope is true for those of you who are working at startups and are thinking about this. I mean, the two things that I think are the most important sort of counterpoints to the fact that a startup is hard is, one, if you work on something you really believe in, it's worth it, and it's worth the difficulty. But the other that's just as important, and I just feel really fortunate for, is when you work with a great team of people, it makes every day so much easier and so much more fun, even if you're trying to do something really difficult. We have a great team, and that's what makes it much less stressful. And I feel really fortunate, not just for the quality of the people, but for the fact that working in healthcare, and I hope you all feel this too, attracts people who want to work in healthcare. So, we have the ties that bind us at a company like Lyra Health in terms of the shared commitment to try and help make behavioral health work better is, just such a powerful force in trying to make it easier, to get through the challenges that you're working on. And I'm guessing that many of you work on healthcare-related opportunities that are influenced by your own personal experience with the system. And I hope you've been able to rally other people around you who similarly sort of share that passion, which makes the stress and the anxiety, I think, much more manageable.
Thank you, David. Appreciate it.
Thank you.